Hello, everyone. I'm Leonel August Rodriguez, the Executive Vice President for Access Medical Labs. I'd like to thank everyone for joining us in another Access Live, where we bring you insights from leading medical experts. Now, we do ask that all questions are submitted via the Q&A, as they will be answered at the end of our lecture. Now, today I am super thrilled to have with us for what promises to be a super insightful and empowering session. In today's session, we will dive into a perspective that's truly often overlooked, but it's deeply foundational to true healing. The topic is how nutrition impacts health. Now, we're going to review this not just symptomatically, but also systematically. We'll explore how the body's core systems communicate, compensate, and eventually signal distress when underlying needs aren't met, nutritionally, chemically, and even spiritually. Our speaker, she brings a clinical framework that blends naturopathic principles with functional diagnostics, to help practitioners shift from reactive care to root cause resolution. She's truly passionate about empowering both providers and patients to identify these hidden stressors, to create individualized protocols, and restore the body's innate ability to heal. Please join me in welcoming Dr. Kimberly Boehm.
Well, thank you so much. That's quite the introduction. I appreciate that greatly.
Absolutely.
Yeah, thanks so much. Let me just start by saying for the opportunity. It amazes me so, and that the premier specialty lab in the nation is really able to support both sides of the medical model, whether that's allopathy or naturopathy. So it's really my privilege to be here today. Let's just jump right in, shall we?
Absolutely.
All right. Can you see my screen here?
Yes, we can, but we can also, it's not in presenter mode. Here we go. Excellent.
Perfect. Here we go. All right. Well, as Leo said, I am Dr. Kimberly Boehm. I am a doctor of naturopathic and original medicine. I am with Functional Health Group out of Richmond, Virginia. And today we are going to discuss healthcare from a naturopathic viewpoint. So the things I want to cover today would be nutrition and the healthcare connection, the hierarchy of nutrients, which might surprise you when we really see what the hierarchy of nutrients happens to be. Effective patient income, or not income, but intake methods, creating targeted protocols versus a one-size-fits-all, root cause identification versus symptom management, and then which labs uncover which healing opportunities. And today we're going to specifically focus on chemical stress because that's the panel that Access Labs has put together for us today, which is going to be a wonderful tool to have in your toolkit. Now, for those of you that are not as familiar with the naturopathic world, it bears a moment to quickly just lay out how naturopathy is different from the traditional, more familiar, right, allopathic practice. An MD. I'm a PhD, not an MD. So the difference here is that in the allopathic world, you're typically going to go to a provider who's going to see you. They're going to give you a diagnosis code that's based on a traditionally reliable cluster of symptoms. And then they're going to put a pharmaceutical drug that matches that code from the ICD code book. And hopefully your insurance company is going to pay for that if you've got a right diagnosis code and a right pharmaceutical drug. Also, having a nursing background before I went back and got my doctorate, I can tell you too that the number of patients that allopathic practitioners are encouraged to see every day is a far strain more than the number that I see. We were seeing 32 people a day as a minimum in the allopathic practice. So that's roughly somebody every 15 minutes. So that's not as much time. You don't have a lot of time to really go through everything that's happening with someone. So there's no wonder that really they're able to understand what your symptom is and kind of treat that symptom and move on, right? There are more people waiting that have to be seen to make that business model happen. A naturopathic practice is a little bit different. Insurance normally doesn't cover what we do. And for us, we're not as concerned about diagnosis codes because from a naturopathic standpoint, we're looking at things as there are really only a few things that could be wrong, right? Either you're not giving the body something it needs, the body isn't detoxing things it doesn't need, or something has gone on too long, and now you find that the immune system is compromised or the vital reserve, there's just not enough left to return the body to a place of homeostasis. It is my belief that the body wants to return to a place of homeostasis, and if we can create the proper environment, it will try its best to do that with the amount of vital reserve it has left. So case in point, if you had a case of food poisoning, the symptoms that you might have of nausea, vomiting, diarrhea, whatever that may be, as undesirable as that may be, that is exactly what the body should be doing to try to rid you of the poisons that it's encountering there. So again, supporting these things naturopathically is the way we approach things. Now, when we look at things from a health continuum, the professor at the college I went to actually put this together, and it's showing that the individual tends to run a continuum from wellness to illness. When we look at dynamic vitality, these are people that are in perfect health, they are symptom-free, they are not on any sort of pharmaceutical drug, they are hitting it on all cylinders. But would it surprise you to know that that is generally 5% of the population in our country? Kind of shocking. When you move down that spectrum to optimum health, right? These are people that are still good health, few symptoms, but still probably not on any pharmaceutical drug. That you might see them in that clinical reference range where they're no longer in optimum, but they're starting to slide from the green to the yellow, or the yellow to the orange to the red type areas. But these are still people in good range here, and that's really still only about 15 to 20% of the population. Moving further down, you get the suboptimum health. Now, this is what my professor used to call the walking sick among us. These are people that have chronic conditions for which they are taking a pharmaceutical drug, at least one, mind you. Now, again, these are folks that are 70 to 75% of the population, which is pretty shocking. Debilitating illness would be that last 5%. And these are people for whom we're not necessarily looking for full recovery. They might be in an advanced illness with some sort of dependent care. They might be on hospice. They might really just be looking at quality of life as opposed to returning back up this wellness scale. Okay. Now, moving on, this is the same continuum, but just looking at it from a different angle, really. People at the top of their game, people doing great, people that are walking sick on pharmaceutical drugs, and those that are not likely to recover. Now, from a naturopathic standpoint, I'd like to introduce you to a new way of looking at disease and illness, okay? And we'll go through this quickly. There's a lot here, but we're just going to run through it. You've got your brain that's communicating with your body. It does so by way of blood. It does so by nerves. It does so by, the food that you eat, autonomic nervous system, any number of things. But let me ask you a question. Is it coming up on your screen? Because mine kind of looks like it froze. So I don't know whether you're seeing these additional elements. Let's see if we can.
It looks like it's froze as well too, Dr. Boehm.
Okay, let's see. There we go. So maybe it's just a delay. Let's see if we can get back to it in here. All right, let's see if we can jump back in. Okay, so when the brain is talking to the body, right, what it's doing is it is providing us with function of the lungs, the nervous system, all the main systems of the body, hormones, immune, detoxification, digestion, all of those systems. And it's providing us with 100% function. Now, when we have 100% function, we have an ease about the body. We are operating with ease. The problem comes into play in that no one comes to see me when they are operating that way. People come to see me when they have symptoms. Now, symptoms, I'm going to move through this. I see that I'm froze up again, but I'm going to keep going for the sake of presentation and maybe skip through this. When people have symptoms, right, they want relief from those symptoms. And that's typically where the allopathic care is going to come into play. People want their symptoms resolved, and that makes perfect sense. So from a naturopathic standpoint, we are also going to do something for the symptoms, but I'm more concerned with those other two bubbles, which we're going to refer to as metabolic chaos. And that would be, functionally speaking, what has gone wrong. If symptoms are the last thing to show up, that must mean that something has happened. There's a lack of ease. If there's a lack of ease, well, there must be some function that is no longer operating normally. And I believe that if all we do is address the symptoms, that is where we're seeing on that health continuum that people are going on to get the next thing and the next thing and the next thing. So how do you resolve that metabolic chaos area? We believe that you do that by, again, looking at function and what impacts function, right? That's going to be things like the diet, the rest, exercise, stress reduction, supplementation. But anytime you see stress on the body, that can be mental stress, emotional, that can be perceived, real or perceived, right? Because as we all know, the body has a very difficult time telling, or the brain does, whether something's really happening or whether you're just ruminating on it, right? It happened yesterday, but in your mind, you're still thinking, can't believe that happened. I can't believe she said that. The next time she says that, I'm going to say this. Yeah. But your body still has the same reaction. So that's mental stress. The biomechanical stress would be the physical stressors on the body. And this is how you've lived your life. What has happened to you? Did you play sports when you were a kid? Have you had a motorcycle accident? Have you been in vehicle accidents? Do you have repetitive motion things? Anything, a spine that's not aligned, anything that might affect the actual skeletal system of the body. And then my favorite would be the chemical stress. And while chemical stress is probably the hardest to find, it is actually the easiest to resolve. So I may not be able to handle, if emotional stress for you is you really don't like your job, or you've got stress in personal relationships, I might not be able to help you get some of those big rocks out of your pile. But if I can help you get the smaller rocks of all the chemical stressors out of the pile, that still reduces your toxic burden. Okay, so here's where my slides are moving perfectly as they should have before. Let's just click on 3 of these and we'll keep going. We're really having a time with this internet connection, aren't we? So let's see if we can't get back to that. We will jump back in here. See if we can move on. Perhaps it was that slide was so busy. Now, if you think that my numbers seem awfully high and those numbers just seem hard to swallow, I put this slide in every lecture that I do across the nation. And this would be the one for the CDC, right? You can go to cdc.gov/chronic disease, and it's going to show you right there on the web page that 6 in 10 Americans, adults that is, have a chronic disease for which they take a pharmaceutical drug. Right there on the CDC page. So that's more than 50% of the population. Now, that's alarming to me, right? That many people are walking around on a pharmaceutical drug. But the more interesting thing, if you move to the right, it says 4 in 10 take 2 or more. Now you think, how could that be, right? Because weren't those 4 people in the original 6 that were already seeing a practitioner for something and were already on a pharmaceutical drug, yet they went on to get the next and the next and the next. And I can tell you as a naturopathic doctor, I'm not the first person most people come to see, right? They do the whole gamut of allopathic doctors where, I don't know, your labs are normal, I'm going to send you to gastro. Don't know, your labs are normal, send you to endocrinology. So It is interesting that because when people come to see me, right, they're already on it, at least a couple. They got their blood pressure medicine, they've got their cholesterol medicine, they've got their thyroid medicine or their blood sugar, but you tend to then start getting that witch's brew of uh, side effects, contraindications. And so now you're not just fighting whatever the process was, you're now fighting one medication, fighting the other. So interesting data there that just goes to show, if you're unaware, the numbers are staggering. Now, when we look at the nutrient hierarchy, it always surprises people that we break it down into 5 groups, and that group number 1 doesn't even have anything to do with what you put in your mouth. But again, the hierarchy, things that are most important to what's least important. Group number 1, air, water, sunlight, the Earth's magnetic field. We could do a whole session on that, but those are more important. You can live a lot longer without fruits, vegetables, seeds, nuts than you can without fresh air, right? You wouldn't make it to the end of my presentation today if we didn't have air. Same with water, lasts a little bit longer, but you can't live without water, without sun, right? So we focus on that first, which surprises people, but that's our group 1. Group 2 would be the raw foods, fruits, vegetables, nuts, and seeds. Now, what I love about this is that group 2 is just a mini cocktail of group number 1. Everything here was grown in the ground. It had to have sunlight, it had to have water, it had to have air. So it's very close to that. Not only is group 1 nutrients, that package is free, right? We get all those for free. Group 2 are things that are plentiful but need very little, if any, preparation to have them, which is beautiful. I get people all the time who say, oh, I don't like cooking. Great, I've got something for you, right? So, and they also have the naturally occurring enzymes, by the way, that help you break down the food to actually use what's in it. You move a step to the right, group 3, grains, legumes, wheat, corn, oats. Again, these are wonderful things. They're grown in the ground, sunlight, air, water, but what? They last longer, right? Group 2, you have to consume pretty quickly after you pick it off the tree, the vine, out of the ground. Group 3, you can harvest it and hold on to it longer. Nature's provision. We didn't always have refrigerators and ways of storage. I will say that a lot of people say, but wheat, oh, gluten. That's true. Today, it didn't always used to be that way. Things that are in wheat and breads today, I can promise you, are not in even the things that I had when I was a kid. Today, we have genetically modified seeds, right? Where companies are just going ahead and injecting the pesticide into the seed. So when the farmer plants it, the seed poofs open, right? So does the pesticide, which saves farmers a step, right? Because you've got to get more yield now off of the same square acre of land to feed everyone. But you're putting the genetically modified seed in there. What could go wrong with that, right? So you're really going to want things that are non-GMO. When you get to group 4, now you're starting to get more into the standard American diet. Beef, pork, poultry, fish. And again, you need protein. You can get protein without flesh meats, but I'm not opposed to flesh meat. And you say, yeah, well, they're outside. They've eaten all these things. Yes, they have, but now you're getting it secondhand, right? You're eating the beef that had the corn, right? You're eating the pig, the bird, whatever that may be. And mind you, with the animals now, we're dealing with steroids, we're dealing with antibiotics, right? These animals are sold by the pound. So they're literally walked over scales to see how much they weigh. You want them to weigh a lot. So that can be problematic unless you're looking for meats and things that are free range, that are steroid free, antibiotic free. Then we get to the last group, group 5. These are things that you can eat them, but they don't necessarily provide any nutritional benefits. It's pretty shocking when you try to read the label. A lot of people from this group, I find in my practice, might be obese. They might be, we call it overconsumptive malnutrition. They are overweight because the foods they're eating are not providing any nutritional value or not much. So the body is still craving. I'm still hungry, feed me, right? So they continue to eat, over consuming, but they're never full because the body is not getting what it needs, nor is their body operating properly. So those are the 5 groups and that hierarchy of nutrients, and then the standard diet being group 4 and 5 usually. Okay. If you think that group 1 is not number 1 and super important, I just added some of these slides, but it speaks to the fact that, you know, our western part of the US has been on fire, right? California fires for, it seems like months now. I was just in Yellowstone last week, saw a lot of forest fire damage there. But the things that are in the air that we breathe, super important, whether it's forest fires, whether it's industrial waste, water, super important. I'm a little embarrassed to tell you that this is actually my house, my husband's hands, and that is a filter to our well. After 6 weeks of use, he's changing the old filter for the new one. So I say you can either buy a filter or be one, because what would happen if we didn't filter that water out? We would be drinking that, cooking with that, washing our clothes with it, bathing it. And I can tell you that when you turn on the tap at home, it doesn't look like that when it comes out of the tap. So you don't realize that you're even getting a lot of that. But if you don't think that's problematic and will clog you up, and the government, just so you know too, remember, it creates no standard at all. It's up to you to make sure that the water coming into your home, if you have a well, is drinkable. So remember that one. And then of course we've got the Camp Lejeune. If you're from the East Coast here in the US, Camp Lejeune, Jacksonville, North Carolina, water contamination from 1953 to 87. Lawyers are still chasing people about the cancer that they are realizing now that is caused. Or East Palestine, Ohio, the train derailment in 2023, you can see all of the toxins and oils and things that are seeping into the groundwater there and, contaminating fish, animals that drink out of these streams, what's going into the soil. So super important. You think you're out of the way when you've got city water, right? January of this year here in Hanover, where I live, there was a water treatment plant equipment failure. Somehow sewage water got into the regular water system. So for days, people on the east side of I-95 had no water. People on the other side had to boil their water for days. So you really have to be very mindful. It's like you have to be your own advocate because you're never quite out of the way there. Side note, Environmental Working Group does a great job. They've got a website, ewg.org/tap water. You can put your zip code in there and it's going to come up and show you 23116. That's mine. People in my zip code are serviced by the Hanover Suburban Water System. They service almost 58,000 people. You click on that and you'll see what's in your water, right? 65 times the amount of chloroform that should be in the water. They freely show it's a cancer-causing agent. There's no legal limit. 244 times the HAA5 acid, another cancer causer. Chromium, they're all kind of things, right? They tell you what's in there. I think that people they don't understand that things slip through, and as long as they tell you what's in it, they've done their job. Scroll down to the bottom, it'll tell you which filter to purchase to filter out the thing that's in your water. Nothing worse than buying an expensive filter that doesn't filter out the one thing that's in your water that needs to come out. And you can usually get those little tests, by the way, at Home Depot or Lowe's. They have them for free and they'll test them if you don't want to go to the site here. Anyway, when we look back again at that hierarchy of nutrient, what I want you to see is the connection, right? Here's the way it lays out, and look back at this health continuum. The left side, dynamic vitality and optimum health. The right side, optimum, suboptimum, or debilitating illness. Those are the people that are eating from group 4 and 5 and missing out on groups 1, 2, and 3, which is where the healthy people, it's where the healthy people are. So how can I help you, right? Clinical assessments is huge. I probably ask people more questions than any provider they've ever been to. And that's because I really want to get that patient context. I ask them to self-assess their diet, their rest, their exercise, stress reduction, supplementation, medical history, spiritual health. A lot of people hesitate to go there, spiritual health, right? That can be controversial. I'm not asking that from the context of which spiritual practice do you participate in, right? What I want to know is there something there where you've either got, church, temple, synagogue, whether that looks like for you, a gratitude practice, a meditation practice, whatever that looks like, because I can tell you this, while I may not have every answer, I can tell you this. Studies show that patients that have a strong spiritual body, mind, spirit connection have better clinical outcomes. They have more hope, they are happier, and again, they have better clinical outcomes. So for me as a naturopathic to treat the whole person, that is also an important element. Metabolic chaos scorecard is something else we do where we are asking from a quantitative nature more questions that are really looking into those 6 foundational systems we talked about, the hidden type systems, hormones, immune, digestion, detoxification, energy, and nervous system. Because what I want to see is quantitatively, are you getting closer to wellness? Or are you moving further away, right? I want to determine where function has been lost and to what degree, so we can deal with those imbalances, right? Now that is the subjective data. That is somebody telling me how things show up for them, how they feel. It's important to also use objective data. And here's where my partner, Access Medical Labs, come in, because they are providing functional lab testing on all those systems of the body that give us the objective data. This is just what's happening, right? So then I take that objective data, I lay it on top of the subjective data, and now I come up with the healing opportunities and build a custom protocol that is addressing all of those things. Okay. Again, when it comes to diet, rest, exercise, stress reduction, there's some things that we're always going to do. We're always going to focus the diet on those categories 1, 2, and 3, and a little bit of 4. Access Medical Labs has a fantastic food sensitivity lab panel as well. It was just a special not too long ago where it also had environmental allergies. That is a beautiful lab that can be extremely helpful for you. Sleep is more, or rest is more than just sleep, right? There's rest that creates room for other things in your life, appreciation of relationships and, your job, right? You love your job a lot more when you're not working 80 hours a week, I'm sure, or when you get to get away from it a little bit, right? And so it's building boundaries around even things that are necessary and good, but they don't need to be ruling your life. Exercise, I always tell people, you don't need to be, everybody doesn't need to be flipping tires in the parking lot, right? It's beautiful if that's where your exercise level is. Most of the people I work with are not. We're trying to move blood, oxygen, lymph. We're trying to detox with sweat and breath and other things. So movement, I prefer. Most people hear the word exercise and they just go, ugh. Stress reduction, we talked about that. Supplementation, we don't use a ton of supplements, but we do to either add something into the diet that's currently missing until we can figure out how to put it in there to support something while we work on it, or maybe pain reduction. I'd rather you take supplementation for that than be popping pain pills. But again, not opposed to allopathic care when it's needed. It is needed sometimes. But a lot of these things we can do from supplementation. Spiritual health we talked about, and then temperance, right? Temperance is just one of those naturopathic words because, we hear people say all the time, oh, all things in moderation. Yeah, I kind of look at it from all good things in moderation. That sounds better to me. All good things in moderation, and then abstinence from injurious things. There's just some things you don't need. Nobody has an alcohol deficiency. Nobody has a nicotine deficiency, right? So we try to look at things as naturopathically as possible while still having quality of life and, a piece of cake on a birthday. That's the way it flows. Now, which lab test to use for what? Again, that food analyzer is a beautiful one for food sensitivities. If somebody's got GI issues, if they've got low immunity, if they are having, gas, bloating, nausea, diarrhea. Heavy metals. I love the heavy metals one. The one that we're highlighting today is actually panel number 8406. It's the heavy metal basic panel, and it's going to have the heavy metal toxins in it that I like to assess when it comes to neurological things: depression, Alzheimer's, dementia, Parkinson's, autism, ADHD. Or when I have a naturopathic case that is not moving along quite as quickly as I might like, or not at all in some cases, and it's stubborn and you just can't figure out, what, there's more here, I'm not finding everything. That's the one to run, because you will inevitably find things that you can clinically correlate back to your patient assessments to see, aha, high chromium, or high cadmium, high nickel. What do we see there? Batteries. What does this person do for a living? Oh, they're a welder, or oh, they work at Batteries Plus, or, so there are ways to do that detective work to figure out what you're actually working with. Certainly the advanced hormone test that they have is fabulous. And so, obviously the basic and the enhanced wellness, where you just have that basic of, complete metabolic panel, A1C, lipids, thyroids. Those are the normal baseline types of things. And then again, what do you do if you find heavy metals, right? So we always include some sort of chelation therapy, binders, if you will. So we're going to start low and slow. There's different binders that you use for different heavy metals, different mycotoxins. My favorites tend to be chlorella or the fruit pectins. Those are generally the most gentle. You can use them longer without fear of nutrient absorption, right? Because clays and charcoals, they might also bind some nutrients there, so you would want to be careful there. And then fruit pectins, kids can even do that, and the taste is pretty tolerable. So you can do gummies, they have chewable tablets that take, tangerine flavored, any kind of flavor. But the key with kids is just getting them down, right? Where they may not like a chlorella, but they would easily do the fruit pectins. Clays and charcoals being the strongest. I might save those for acute things like a food poisoning or vaccine aftercare, something that you're just going to do for a couple of days. The clay kind of falls somewhere in between the chlorella and the charcoal. Always take them away from food, always take them away from medication, so that you're not binding those things up and exporting them out as well. I like to generally go an hour before, 2 hours after meals, and then just make sure you're drinking lots of water, because constipation can be a side effect if you take too much or for too long of a duration. So you could always add like a vitamin C or mag citrate or something like that to kind of push things along. But just plenty of water normally does the trick for you. Here is our panel, 8406. These are the metals that will be tested. It is a beautiful price of only $80. I recommend that you get two. The first one you would do on the front end to actually identify the heavy metals that are present. And then I would also do one at the end of my protocol to make sure that I had resolved those back down to a normal level. At that price, you can practically get two for the price of one. So I would definitely do that. If you haven't seen that report, it's fabulous. I love the graph. It's easy for people to look at and understand what's happening. It is pre-provocation, obviously this particular result you're looking at, so pre any type of protocol. And then if you want the heavy metal plus, that one is not highlighted today, but I love that one too, because that one has not just the toxin metals, it's also got nutritional heavy metals. So the first one you might be looking for things that are considered out of optimal range. Here you might be looking for deficiencies rather than highs. Okay, so keep that in mind. And that's a ton of information, but I'm going to land on this last slide here about the basic panel and see if anyone has any questions that they'd like to pose.
Dr. Boehm, what an amazing lecture. Thank you again.
Yeah.
Truly appreciate it. I have quite a few questions for you. So I'll kick it off with this one. This is in regards to the metabolic chaos.
Yeah,
So how do you track progress across the metabolic chaos of the framework over time, subjectively and objectively?
that's a great question. So subjectively, uh, we would redo the metabolic chaos scorecard, and we would have the patient tell us, and we have bio trackers in the medical software that we're using. Our software has bio tracker data. So they're getting a text, or they're connecting their wearable devices to our portal. And so every day, whether it's energy level, you might get a text 1 to 10, where's your energy level? So every day they're popping it in there. Or sleep, every day they're putting it in there, and it's creating a graph for them. So every time we meet, we have a visual that is their own subjective data. Are we getting closer, or are we not? Do we need to dial it in a little bit more or not? And then from the objective, you simply run your test again, because whether it's heavy metals, whether it's H. pylori, whether it's candida, whether it's, the number of food sensitivities or whatever that may be, so we can look at it both ways. So I'm never surprised when we get to the end. We saw ourselves getting there, or we saw early on, we were not moving the needle, and we were able to adjust accordingly so that we regained the ground we had lost, and keep going.
Beautiful. I love that. And when you are treating your patients, do you have any sort of clinical algorithm or like a decision tree, for lack of better words, when building a layered protocol that does include, your detox, your gut repair, your endocrine support, and then you also mentioned your spiritual or emotional care.
Mhm. I like to say every girl needs a new dress, right? Everybody needs a dress. And that's diet, rest, exercise, stress reduction, supplementation. So the way I work mine is that after we do all of our labs, after we do all of our subjective data, we get together for a 90-minute report of findings. And that's longer than any other practitioner has ever spent with them. They're blown away that you could talk to them for 90 minutes. And the truth is, you can barely get it all in there. And then about every 2 weeks or so, depending on how much support they really want, we will get back together, and we will move from that initial 2 weeks of relief care, where we're kind of grabbing the low-hanging fruit. You might be removing food sensitivities, you might be, working on, H. pylori eradication or whatnot, but we grab the low-hanging fruit. And then from there, they start to feel better. They see their energy going up. They see the nausea going down, the bloating going down. Then we move from relief care to corrective care. And that's where we do the deep dive. And I will let them drive the bus. They can pick wherever they want to start. But generally, we start with diet. To me, that's the most impactful. And then we move into, they get workbooks, they get all kind of things to help them along the way.
In regards to the diet, right? Do you determine, any sort of nutritional deficiencies, or what it is that they have to intake at all?
Yes, we do. So what we do it from a number of different perspectives. Certainly, we're going to remove food sensitivities. That's going to be a huge thing. But then we're also doing metabolic typing, because what comes to my mind is the Atkins diet, right? High protein, low carb. That's beautiful for some people, not everyone. That's why one antibiotic doesn't, make everybody well either. And so my peeve is when somebody says, I did Atkins and look at all this weight I lost. You did it and you didn't lose any. You must have cheated along the way. And no, everybody's not a protein type. Some people, if you have a fast metabolism, you need slow burning fuel. Well, protein burns, it takes longer to burn, right? So you can eat and be happy. But if you have a slow metabolism and I load you up with protein, you're going to feel disgusting. You're going to, it's too much. So you need fast burning fuel. You need carbs. If you have a super fast metabolism, you might need dark meat as opposed to white meat. Dark meat's got more purines in it. It's going to last you even longer. But we tend to gauge, can you get from breakfast to lunch without feeling like, oh, I got to have a snack? Because if you can't, you're probably not getting enough protein, but we can dial that in along the way too, and make sure that we've got people eating the right type of diet for them without their food sensitivities. We work on their gut, and then we add those sensitivities back in, but according to least offending to most.
Love it, love it. Now, earlier on in your presentation, you mentioned toxicity in neurological disorders. Do you correlate heavy metal load with neuroinflammation?
Yes, I do. Now, but here's the thing, right? And even something as simple as a headache might be a great example. People tend to think there's one thing causing their symptom. I find that to rarely be the case. Even if it's something as simple as a headache, right? I can give you something as benign as an aspirin, ibuprofen. Maybe we move to a Maxol. Maybe we go with cutting edge. I think it's Ubrelvy is the latest one, right? But that might stop the symptom, but I want to know, why does your head hurt? And honestly, it could be a number of things. It could be a structural problem. It could be hormone imbalance. It could be food sensitivities. It could be chronic stress. It could be dehydration, right? So I'm more about finding the why from all the different systems as opposed to just the one. But yes, it's not uncommon to see folks that have high mercury levels, aluminum toxicity, nickel, and you start to see some of these symptoms. Because for us, we're not really as interested in what to call it, what to diagnose it. I just want to find it and resolve it. And
Love it.
yeah.
I love it, Dr. Boehm. Now, before we wrap up, you mentioned a 60-minute presentation regarding chelation. So,
Yeah, I've got it.
yes, how can we get access to that? How can the audience get access to that?
Yeah, let me see if I can grab that and put that link in there for it, and that maybe I can put that in the chat box. I'll do that because and it's not my lecture actually, but it is another lecture on binders and chelation. And there's a great paper attached to it called the top 6 toxic binders, and it'll tell you, in general, what to use for what. There are some things that are better for mycotoxins. There are some things that are better for lead. There are some things that are better for what. So giving you an idea of where to start if you've never done a lot of work with binders, it gives you some guardrails, if you will. Now, again, not one thing for everybody, but it gives you guardrails and a good jumping off point.
Beautiful. What we could do is, Dr. Boehm, we can actually send an email post the lecture to, if you can't find the link, if you can, great. But we can also send an email to all of the attendees post the lecture with that link as well, too.
Absolutely. Happy to do that.
Beautiful. Well, Dr. Boehm, we're at time. It's truly been an honor having you. And on behalf of Access Medical Labs, thank you again for just such an amazing webinar on the hierarchy of nutrition. Truly appreciate you and your time and your knowledge as well, too. So thank you.
My pleasure. My pleasure. Thanks for having me.
Absolutely. Thank you. And to our audience, thank you again for tuning into another Access Live, where we bring you insights from leading medical experts. We do ask that you don't forget to like, subscribe, and stay healthy. Till next time.